going to go through the blood circulation in the correct order, the route of which it must flow. There is the right atrium, the tricuspid valve, the right ventricle,
I can't see.
the pulmonary
Hold on, let me get
semilunar
it.
valve, pulmonary trunk. The blood goes out to the lungs, drops off carbon dioxide, picks up oxygen, comes back in the pulmonary veins. Left atrium, bicuspid valve, left ventricle, aortic semilunar valve, ascending aorta, aortic arch, descending aorta, out to the capillaries of the body where it drops off oxygen, picks up carbon dioxide, comes back in the superior and inferior vena cava. Now I'll do the electrical flow. The SA node depolarizes. The atria will contract at the same time. That impulse travels to the AV node, goes down the bundle of His, the left and right bundle branches, to the Purkinje fibers, where the ventricles depolarize and contract in an upward direction. The backside, exterior structures, you're going to use your fingers as little rabbit ears. The jugular veins branch off of here. Brachiocephalic veins branch off of here, so we have two rabbits. Brachiocephalic artery, subclavian artery, common carotid artery. The right and left coronary arteries, left coronary artery, right coronary artery, the anterior cardiac vein. The coronary sulcus is a groove in the back with the coronary sinus. The anterior interventricular sulcus is the groove in the front. There is a left and right auricle, which it says on this form to also tell me the function. They increase the atrium volume to allow for the correct amount of blood to enter the atriums. Ligamentum arteriosum was ductus arteriosus in the fetus, and that was a shunt because the lungs are not developed while the baby is in the womb, so blood circulated back through the baby. Then it closed off, and you spank the baby and it cries, and that's oxygen. Associated with that is, while that was ductus arteriosus during fetal development, there's also foramen ovale, which is a hole of foramen. Blood, since it didn't go to the lungs, it didn't come back from the lungs to the left atrium. The left atrium would never have known how to contract and fill with blood if it were not for foramen ovale during fetal development, which then becomes fossa ovalis. There's also the coronary sinus opening. Trabeculae carnae is the muscle of the ventricles. Chordae tendineae hold on to the valves and prevent prolapse. The papillary muscles hold on to the chordae tendineae, which hold on to the valves, which prevent prolapse. The interventricular septum is the separation between the ventricles. Then surrounding structures would be first trachea, then esophagus. The right and left bronchus go to the right and left lungs. The diaphragm is underneath. And there's three layers of protective covering: the fibrous pericardium, serous pericardium, visceral pericardium, with pericardial fluid to prevent friction.